So for this video, we are going to conduct an assessment of the abdomen. The assessment of the abdomen is done to check for possible pain, distension, and enlargement of organs or masses.
Before starting the procedure, first you must assemble the equipment. Check for the stethoscope, examining light, tape measure, and skin marker. For the procedure, first is you need to introduce yourself and verify the patient's identity. Explain to the patient what you are going to do, why is it necessary, and how the patient can cooperate.
Good morning, sir. I am Ashley Garcia po, your student nurse for today. And sir, for verification, I would just like to ask your name po and your birth date.
I am Verci Espineli, May 16, 2000.
Okay, so today, sir, we'll be performing the abdominal assessment. So the purpose of this is for us, your healthcare providers, to know if ever you are encountering some problems in your stomach, or we will find ways to prevent those complications, sir. Will that be fine, sir? Rest assured, sir, that all the information that we will be acquiring will remain confidential.
Perform hand hygiene and observe other appropriate infection control procedures.
Okay, sir, so I'll be asking you some questions, so let's proceed. Sir, have you encountered or are you encountering any abdominal pain?
No.
No. Okay, sir, how about your bowel habits? How is it?
It's normal.
It's normal. Or have you encountered constipation or diarrhea? So, is there any significant change in your appetite?
No.
As well. How about the food you've ingested within the past 24 hours, sir?
I ate chicken,
Chicken.
adobo.
Okay, so sir, let's start the assessment now.
Then position the patient. Assist the patient to a supine position. Place a small pillow under the head and beneath the knees.
Sir, is it fine? I'll be exposing your abdomen.
Expose the abdomen from the xiphoid process to the level of the symphysis pubis.
Inspection of the abdomen. Inspect the abdomen for skin integrity. If there are any presence of striae or any skin lesions or rashes, inspect the abdomen for contour and symmetry. While at the patient's side, sit or bend down to view the contour of the abdomen. Ask the patient to take a deep breath and to hold it. Assess the symmetry of contour while standing at the foot of the bed. If distension is present, measure the abdominal girth by placing a tape around the abdomen and measure it at the level of the umbilicus. Observe abdominal movements associated with respiration, peristalsis, and aortic pulsations. Observe the vascular pattern.
Auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction rub. For auscultating the bowel sounds, use the diaphragm of the stethoscope. Apply light pressure from the right lower quadrant, then proceed clockwise for at least 60 seconds. Then auscultate for the vascular sounds. Using the bell of the stethoscope, apply light pressure beginning at the middle line below the xiphoid process. Then proceed to auscultate the renal arteries, iliac arteries, and femoral arteries. For the friction rub, use the diaphragm of the stethoscope. Place it lightly over the right and left lower rib cage. For the percussion of the abdomen, percuss several areas in each of the 4 quadrants to determine presence of tympany and dullness. Ask the patient any painful areas in the abdomen.
Sir, is there any painful areas in your abdomen?
No.
Percuss abdomen using proper percussion technique. Begin in the right lower quadrant, proceeding clockwise. Percussion of the liver. Percuss the liver to determine its size. Percuss upwards, beginning from below the level of the umbilicus at mid-clavicular line, right lower quadrant. Note the change from tympany to dull, and then mark this point. State significance of findings.
So, sir, based on my findings, your liver span is around 7 centimeters, which falls under the normal range of 6 to 12 centimeters. So, sir, next that I'm going to do is a kidney percussion. For this assessment, you have to assume a sitting position. Is there any pain?
No. No.
So, sir, based on my findings, there are no any elicited pain over the areas, so everything is considered to be normal.
Okay.
Next is the palpation of the abdomen. Ask patient for any abdominal tenderness.
So before we start, sir, does any part of your abdomen hurt?
No.
Perform light palpation first with hand held flat and relaxed and molded to abdominal wall. Palpate the abdomen with light, gentle dipping motion. Systematically explore all 4 quadrants. Then perform deep palpation over all quadrants. Then palpate the liver to detect enlargement and tenderness. Place left hand under the lower portion of the ribs. Tell the patient to rest into your left hand. Lift the rib cage with your left hand. Place your right hand into abdomen, fingers pointing towards the patient's head or somewhat oblique position. Ask the patient to take deep breaths and with an inward-upward thrust at the costal margins of your right hand, feel the edge of the liver with your fingertips.
Sir, you were complaining that you were experiencing a pain in your abdomen, specifically in this area. So,
For
sir,
the rebound tenderness or the Blumberg sign, position hand at 90 degrees angle to the abdominal wall in the area of the abdominal pain. Press hand deeply in a slow, steady movement, then rapidly remove fingers. Ask patient when they felt the pain.
sir, do you feel pain?
Yes.
How about this?
Then state normal from abnormal findings.
Sir, supposedly you shouldn't felt any pain upon releasing of my hand, but based on the reaction, you showed that you were experiencing pain, so it means that you're positive for Bloomberg's.
For the Rovsing sign, position hand at 90 degrees angle, palpate on the left lower quadrant, and ask patient where pain is felt.
Sir, do you feel pain?
Not much.
Okay. Sir, where do you feel the pain?
On my right side.
Okay, sir.
Next is the test for SOA sign. The patient should be in a supine position.
Sir, this time I will expose your right leg. Is it okay?
Yes.
Place your right hand above the level of the patient's right knee. Then ask the patient to raise the right leg to meet your hands or apply resistance as patient lifts the leg.
Upon the resistance of my hand and then while you're raising your leg, you complained of pain, so it means that you're positive for SOA sign.
Test for obturator sign. The patient should be in a supine position. Then flex the patient's right thigh at the hip with the knee bent. Rotate the leg internally and externally at the hip. Then ask the patient if they felt the pain and its significance.
So, sir, tell me if you feel pain.
And lastly, the cutaneous hyperesthesia. While the patient is in a supine position, gently pick up a fold of skin between thumb and index finger and quickly let go along the abdominal wall. Use the proper technique without pinching. Fluid wave test.
Please place your hand firmly along the midline of your abdomen like this.
Ask the patient or an assistant to place the ulnar surface of their hand firmly along the midline of the abdomen. Place the palmar surface of your one hand firmly on one side of the patient's abdomen. Then tap the patient's abdomen on the other side with your other hand. Feel for transmission of fluids against the resting hand and remember not to slap the patient's abdomen. And lastly, the shifting dullness. Then percuss from the flanks, from the bed upward towards the umbilicus. Note change of sound from dull to tympani. And then mark that area.
Sir, please turn over here.
Ask the patient to turn to one side. Percuss the abdomen from the bed upward. Then note the change of sound from dull to tympani. Mark that area.
Sir, the examinations are done po. Thank you so much.
And don't forget to document findings in the patient record.